Hello, everyone. My name is Dan Domkowski. I'm an artificial intelligence and machine learning specialist here at Red Hat. I'm joined here by my colleague Matthew from Perficient, and today we're going to talk to you all about accelerating interoperable data-driven clinical outcomes, how integrating data and making healthcare systems interoperable, providing a 360 view of a patient's data inside a particular healthcare system is going to lead eventually to some amazing data-driven clinical outcomes. Matthew and I are going to walk through the workflows, the software development, and all of the key architecture and best practices towards getting this outcome, which in turn ultimately really provides better patient care, better services, better operational efficiencies for healthcare providers across the country. We're going to be talking about how organizations can solve for interoperability through flows of work, how that eventually leads to data-driven outcomes, and how ultimately doing that in multiple different environments is really what allows a hospital system, healthcare providers to operate efficiently and gather the data that they need in order to make informed clinical decisions. From a software development standpoint, Matthew's going to walk through a little bit more detail on the mechanics, how that actually works, how you can achieve that with Perficient and Red Hat, and how some of those standards are coming down the pike from organizations such as CMS and others to promote this as an interoperable standard for how hospitals come to clinical decisions. And then we're going to talk about how you put it all together and can achieve real outcomes from that. So part one is what I'm going to cover is the workflow, how interoperability eventually leads to data-driven outcomes for a healthcare provider. The truth is that your average hospital system today has so many disparate EMR vendors that they're working with, or EHR vendors, electronic healthcare record systems. And what they have to do is be able to integrate all the decisions being made and all the data that's being generated from all of these different systems. They were all developed and delivered independently from one another. They all follow different software delivery practices. And as a result, there's a lack of standardization on how that data is generated, where it's generated, which fields of medicine are integrating with other systems. And as a result, you end up with disparate data and, frankly, a lot of manual decision making that is based on not all the data that it should. And that leads to an overlapping challenge that ultimately leads to higher costs, because when you don't have interoperability from those systems, that they're all not talking to one another, you lack the data analytics, and you're not able to make use of the data that you are generating. When you don't apply the right policies and security mindsets to that data stewardess, to how interoperability should be working, you eventually get to standards that frankly don't match well, and you're not able to make use of the data that you're looking to use to make informed decisions. And oftentimes what you end up seeing as a result of that is data blocking, that you're denying access to important data based on meeting a lack of standards. So when all of that comes together, you end up with manual decisions that are not made with all the right data at any given point, and it leads to high costs for healthcare providers. And when you solve for interoperability, when you are able to integrate all of these disparate systems together, you're able to integrate messages in a standard way so that EMRs, EHRs, payer systems, patient portals can all speak to one another. That you can ensure that the messages and the standards are going to be exactly the same, that they're going to follow the same formats, that they're going to be based on APIs, they're going to be controlled APIs, and the quality and consistency is going to be high. And as a result, that communication between those systems is going to be seamless. You're able to make it so that this is just the way it works, that they're able to follow messages and often get to event-driven design where an event in one system is able to trigger messages and data being forwarded to another. And then all of that put together leads to real healthcare outcomes, because now you have the data you need in order to make informed decisions. And it's really the spark for advanced analytical outcomes in any industry. For healthcare, it's providing more predictable diagnoses. It's providing cost efficiency. For the automotive industry, it's making it so that we have autonomous driving, that we can teach a vehicle how it can learn to operate in the rules of the road just as a human can. And it's really now becoming more mainstream, if you will. It's becoming more of a reality. It's becoming more affordable because of the amount of data that we're generating, because we're following integration standards, and because we're making tooling available in any environment so that we can do this wherever the data resides. And when you follow that continuous flow of integration, of delivering advanced analytics of that data, and doing so in any environment, you have a continuous flow of work. It's if anything, it's a DevOps flow, but applied to advanced analytics, which you often sometimes see as machine learning ops. And you're able to do powerful things with this because now you can intentionally learn and intelligently learn about your data, what it's telling you across any environment. And delivering interoperability in data analysis consistently and continuously leads you to a consistent flow of work where you're able to repeatedly apply success, learn from failures, iteratively design, and get into an iterative flow so that you can try, error, succeed, repeat, succeed as you go through that continuous flow. And doing so in any environment means that you can be closer to where the data is generated. And you're often seeing that this is a forefront of what edge computing is, which is allowing data analytics to be done closer to where the data is generated so that you're not just forwarding raw data across environments, across cloud providers, increasing costs and spend and time. You're able to make decisions quicker. You can think of this as a scenario where in a healthcare setting, you can be closer to where the patient is. If the patients often have sensors or wearables in their environment, that's something where you can get closer to where that data is, how it's analyzed, and make informed decisions from there. But this is just the flow of the work. There's actually the mechanics of how this is applied, how you're able to do this software delivery. And my colleague Matthew here is going to be walking through how you actually develop interoperability to make it so that systems can talk to one another. Matthew, I'm going to hand it over to you and give you the mic.
Hey, Matthew Rathers. I'm a solution architect at Perficient, specialized in cloud technologies and container platform, cloud native integration solutions. So a quick word about Perficient. We're a delivery specialist. We're trading on the NASDAQ. We have like a very large workforce worldwide and onshore, offshore, nearshore, and so we're able to put together blended teams to deliver. So we have a number of technology-focused business units to cover the whole spectrum of software development practices, and some dealing with legacy products and standards, and some on more cutting-edge technologies. And of course, we have industry-specific business units like healthcare. And so we kind of are able to put all of these together to make something old, and it's kind of this perfect blend of skills to deliver modernization. With regards to Red Hat, we won Partner of the Year award because of our mastery, I guess, of Red Hat products, and success with accelerating adoption of such products. And so Red Hat will typically come in and help you set up this foundational layers. If you can go on the next slide. And usually with OpenShift, that's the base, right? But also some other components that make up the intelligent data as a service solution. And then we come in and just plug in additional capabilities. There's healthcare like fire servers, search engine, AML tools that kind of sit on top of the Red Hat stack, and we help fulfill the business requirement. And of course, like I say, implementation of the specific use cases, and then guidance around things like governance, integration, strategies, etc. I think getting more complicated as you're adding capabilities and help you get on the right track. So the concept and capabilities, right, that Dan was talking about just now, these are things that you need to implement both as a business to remain competitive and have healthcare, provider or within the healthcare industry to do more for your patient users, etc. A lot of it comes from a variety of other industries. When you think about IoT, mobile, APIs, data exchange, it's been around for a while. So the CMS ruling, it just kind of formalizes the need to bring the healthcare systems into the modern world, right? And that's why we see this correlation between the business needs and now the regulatory requirements. And luckily the regulators looked at the current technological landscape and align the requirements to the existing technical standards. So some companies already started moving towards that even before this became a rule, right? And one of these company is Perficient. So how we do it is, we've seen this trend coming for a little while, and it really took two important steps. We started getting our customers prepared for the digital transformation by implementing some of this industry best practices, kind of a generic manner. And then two, we worked on creating some reference pictures or actionable, and selecting the right tools to build reference implementations and to help our customers hit the ground running. And so we'll come back to that in a little bit, but those tools that help with the implementation include OpenShift, of course, change that capture with Debezium, Kafka, Smile CDR, et cetera. So from a strategic point of view, right, we can leverage our considerable experience with all these legacy systems to assess what you currently have, help you come up with a roadmap for successful digital transformation on the long run. But there's also the looming deadline, right, and market constraints, and so the need to get things done quickly. It's a little bit overwhelming just to try and figure out where to start. So we came up with the tactical approach based on what we've seen working with other customers. And basically, we just picked a use case that's easy to understand and delivers real business value quickly, and that's provider search. And so at a high level, that's what you're seeing here. We're tying to your legacy systems and APIs, doing some transformation, preparing the data in the new format with HF7 Fire, and then allowing third parties and yourself, to leverage that data to build new capabilities. All right, and so that provider search, that's an interesting use case because one doesn't have PHI involved, and so no compliance issues. You get that in production without too many roadblocks. And it covers the whole spectrum of interoperability. So it connects your old information sources outside of your organization, legacy databases, etc., to new platform with Fire at its core, and then exposes that data in the new format. It shows you how you can leverage this new data hub to build new capabilities, such as Google-like provider smart search, page, right, with real-time information updates. And then it gives you a comprehensive blueprint for all future integration projects. So This is seemingly a simple use case, right? But actually, it touches on pretty much all the technologies and discipline you're going to have to deal with during your modernization journey. We have expertise in pretty much, every single one of these activities. I'll give you a few seconds to scan that slide. Even if you already started on that journey, you can use that as a checklist, and find out if you're on the right track. And maybe you have some of these things already implemented, but they need to be tied together. And then you introduce like some new tools that you don't have right now to be able to do like things like AI and ML. So this is an example of a customer where we implemented this strategy, or this provider search use case that I was telling you about. That's something that we actually developed. We're not just saying we can do it. We have the backend built for it, that's built on top of OpenShift with Kafka, with Elasticsearch, modern, search engine and modern flow to get real-time information from an old database into Elasticsearch in the right format. We have the whole architecture and development process figured out, right? That's Perficient IP, and we deployed it at big payer company, and their users are already using it, loving it. So that's kind of the first step. It gives you some business value really quickly. It's very low risk and standalone, and then you use it as a platform to jumpstart the entire modernization long-term plan, right? So this customer overall, we're very successful. We're able to do 36 integration in only 6. It's not always that smooth, but we've done that so many times now that we know what works and what doesn't. And so we did a comprehensive assessment there. We blended the best of their people, best of our people, and then we come up with this solid roadmap and just power through and deliver it. And now they're able to do so much more than they could. Of course, from a technical standpoint, they have all these old shiny new tools, things like OpenShift and containers, and be able to like have better operational capabilities overall. But from business outcomes, we're able to do things like real-time claim processing, being able to match patients with the right healthcare providers, recommend preventative care, and just overall improve the communications with their network, right? So this is step one. This is kind of tactical, is getting that provider search use case in place through the pilot program, and then from there it just opens up like a whole new.
Yeah, thanks, Matthew, for that. The way in which you're able to develop integrations quickly means that you can accelerate towards those outcomes. I think one of the use cases that comes top of mind for us with that is what we've been able to build on top of OpenShift at HCA Healthcare, which is the largest private healthcare provider in the U.S. And they have 200 now hospital sites and clinics where they are able to analyze data from 30,000 patients every day. And on top of that, having an interoperability engine that collects that data from all of those various sites, feeds that into machine learning models that have been trained to detect sepsis amongst that data. And being able to do that in multiple environments allows them to take that data in, collect it, analyze it, and then be able to kick off symphony of workflows to alert care managers and providers that a patient is showing signs of sepsis far earlier than they would be able to do that with manual intervention or traditional screening methods. And being able to do that 5 hours sooner at hundreds of sites with 30,000 patients a day means that you're able to save thousands of lives a year from patients succumbing to the sepsis and obviously the trauma brought on by it, and how it affects hospitals throughout the country, and how it affects them from both operational efficiencies, but also more predominantly saving lives. And together, that's something that Perficient and Red Hat can build around different use cases. It doesn't have to be simply for sepsis, obviously, but any field of medicine, based on some of the slides that Matthew shared today, following HL7 FHIR-based data can achieve those kinds of outcomes. So Matthew and I are here. Contact information is below. We're eager to answer your questions. We're eager to help solve some of these solutions for you someday. So please reach out. Thank you very much for today. Thank you, Matthew, too. And have a good one.